Fox 61 Morning News begins now.
It's spring break time for a lot of people, and summer is right around the corner. So if you're planning an overseas trip anytime soon, there are several precautions that you need to take. You may want to visit Bristol Hospital's International Travel Medicine Clinic to make sure you're all caught up on your shots and any medications that you need. And here to talk us through the travel issues is Dr. Richard Zweig. He is the Director of Infectious Diseases with Bristol Hospital, and you are also leading the hospital's International Travel Clinic.
That is correct.
Well, thanks so much for being with us. First off, tell us exactly how the travel clinic works.
Right. The travel clinic is located at our office, and patients are able to call if they're going to be traveling anywhere around the world. I think it's important that they know what kind of precautions to take before they visit certain countries, and we're able to offer that kind of advice to them.
Now, do you call and make an appointment to come in, or can you get that sort of counseling and that walkthrough strictly over the phone?
No, you call and make an appointment through my office, and they set up an appointment, yeah.
All right, so let's talk about the main issues for different countries.
Sure.
What's the most important thing to keep in mind? Well,
the most important thing is that depending on where you go, you have to be aware that you are at risk for certain infectious diseases. The more common ones would be diarrhea. Okay, and that's usually a food and waterborne illness, so that we're able to offer people advice in terms of how to prevent that and also what to give to treat should you develop something like a traveler's diarrhea. But there's a whole host of other infections that you're at least at risk for, though the risk can be small.
Which countries or areas of the world should people be more aware of where they might need to get some shots?
Right, well, that's a good question. What I usually tell my patients is areas like Southeast Asia, the Indian subcontinent, Africa, and all of Latin America. Those are the areas where you really need to know in terms of how to prevent certain infections.
That's when really making the trip is worth it.
Correct.
Right?
Correct.
And what type of shots would people typically be getting if they're going to be traveling to areas like Thailand and India that you mentioned?
Yeah, the most common shots that we give are shots for hepatitis A and for typhoid fever. Okay, those are the injectable vaccines that we give. And there's also pills we give for prevention of things like malaria, okay, which are very important, and then we're able to treat diarrheal illnesses, and depending on where the patient is going, you have to be concerned about yellow fever in certain parts of the world.
Now, recently I went to Belize and actually spoke to someone at one of the clinics similar to yours, and we're talking about going to Belize, and they're asking specifically where you were going, and that makes a difference as well if you're going to be sort of on the coast or deep into the jungle.
That is correct. Right? That is correct, because in certain countries you worry about certain infections, but in the areas of the country, say Brazil for instance, okay, up until last week, it was not recommended that people who go to Rio de Janeiro get a yellow fever vaccine, but now it is recommended. And the reason is because there's yellow fever from the jungles in Brazil that's coming into the urban areas, and there's concern about that. So you have to know where you're going and what country.
And sometimes you might not know which areas have just been updated as far as which...
Correct. You have to keep up to date with the CDC guidelines, the World Health Organization.
And that's too much work for us to do on our own.
It's a lot of work for me to do too.
Yeah. All right, well, thank you so much. Very helpful for myself and also a lot of travelers out there. We're going to have the information on the clinic on our app. We certainly appreciate your help.
Sure.
Thanks so much.
All righty.
Coming up next for you here on Good Day Connecticut, an early